Autism is becoming a growing epidemic in the United States, and it definitely needs to be addressed. And I want to compliment, really, Congressman Burton for his leadership. He's not here now. I think is he here? Yeah, and for being the chairman of this committee and doing such a fine job. But you have really focused on this, and I think you've made some progress. And I want to thank you for your leadership on this issue and so many others, and express my gratitude to you and how much I've enjoyed working with you. Now, the numbers that he pointed out earlier, that it used to be 1 in 10,000 kids got autism. It's now 1 in 88. And I'd like to ask Dr. Boyle why. And I don't want to hear that we have better detection. We have better detection. But detection would not account for a jump from 1 in 10,000 to 1 in 88. That is a huge, huge, huge jump. What other factors could be part of making that happen besides better detection? Take better detection off the table. I agree we have better detection, but it doesn't account for those numbers.
So just to put it in context, better detection is accounting for some of it. Like
right, I know some, but what other factors? I don't want to hear what other factors.
Our surveillance program counts cases of autism and establishes the prevalence. It doesn't tell us all the answers to the questions as to why.
Okay.
So we are doing a number of studies to try to understand the why. And one of the things doesn't tell us all the answers to the questions as to why.
Okay.
So we are doing a number of studies to try to understand the why. And one of the things that we've looked at, we've tried to look at what's changed in the environment of things that we know are risk factors for autism, things like preterm birth and birth weight and various...
Well, are you looking at vaccinations? Is that part of your studies?
So let me just finish this one. So
I have a question. Are you looking at vaccinations? Is that part of pardon me?
So there is a large literature, as I mentioned.
Are you having a study on vaccinations and the fact that they're cramming them down and having kids have 9 at one time? Is that a call? Do you have any studies on vaccinations?
There have been a number of studies done by CDC on vaccinations as well.
Could you send them to the ranking member and the chairman here?
Yeah.
Now I want to tell you a story. We all react to our lives. And I remember people talking about hormone replacement. It's going to save women's lives. You got to take it. Yet every nurse I talked to said, go to the bank, it causes cancer. Every relative that got cancer said they got it because of the hormone replacement. I'm hearing the same kinds of stories on vaccination. I must have had 50 different parents write me or come to me and say I had a healthy child, yet then they had 10, 9, 6 vaccinations at one time, and that child changed overnight and was knocking their head on the wall, and it was a changed child. In fact, I had a family in my office today where the mother broke down crying, saying my child was wonderful, bright, precocious, talking. She took those vaccinations, and the child became very incredibly sick and has never recovered. So I'm interested in any studies on vaccinations and trying to understand that. Now, it used to be that you'd go and get a vaccination. My child never got more than 3 at a time. And in the state of New York, children are recommended to get 6 shots every 2 months throughout the first year of a child. And my question is, why?
Mike, welcome to the show. We appreciate you being on tonight.
Thanks for the invitation, Joe.
Okay, let's talk about the rat of the week. Why is Bayer Corporation the rat of the week?
Internal documents show that after this company positively, absolutely knew that they had a medication that was infected with the AIDS virus, they took the product off the market in the U.S. and then they dumped it in France, Europe, Asia, and Latin America. The medicine's called Factorate. It was an injection medicine that was used for hemophiliacs, mostly children. Children had been born with an incurable disease.
Hold on, Mike. So, hold on. So you're telling me that Bayer knew that this drug was infected with the AIDS virus. They yanked it from the market in America, and then they dumped it in markets overseas?
They had to figure out a way, Joe, to make a profit on a product that they could not sell in America. So they made a huge profit. They dropped the product in Japan, Spain, and France. By the way, Joe, government officials in France that allowed that to happen actually had to go to prison for it. In America, not one corporate executive for this company has been indicted or even criminally investigated by our Justice Department.
Why not? What, you're telling me that these people that dumped this AIDS-tainted blood in foreign countries, who killed children, have not been taken to task in the United States?
It's worse than that. The U.S. government allowed it to happen. The FDA allowed this to happen. And now the government is completely looking the other way. Thousands of innocent hemophiliacs have died from the AIDS virus. And not only they're dying, their family members are dying because they're becoming infected with the disease. This company knew absolutely that they had a problem with the product. They knew that it was infected with AIDS. They dumped it because they wanted to turn this disaster into a profit.
Mike, I want to read to you what Bayer told the New York Times about this scandal. They said Bayer behaved responsibly, ethically, and humanely. Decisions made nearly 2 decades ago were based on the best scientific information of the time and were consistent with the regulations in place. That sounds like a lot of legal mumbo-jumbo. Now, you say you have internal documents that show that they knew that this drug they were dumping was tainted with the AIDS drug? Or the AIDS virus?
The documents show that there was no question that this company absolutely understood the risk, that they knew that it was contaminated. It wasn't a possibility. They knew it was contaminated. Americans were dying from the product before it was pulled off the market. The only reason it was pulled off the market is because lawyers found the documents and showed it to the government, and finally the government said, you can't sell it here, but then the government allowed them to dump it in Spain, France, and Japan.
That's amazing. That's just amazing.
Well,
I want to read to you what the New York Times said, and this is an investigation that they also did, and they said the federal government was part of the problem while the Food and Drug Administration told the company not to ship the drugs overseas. The man responsible for the drug supply, quote, asked that the issue be quietly solved without alerting the Congress, the medical community, and the public. This is a cover-up, and our Congress...
Hello, Mary Tocco here, and this is part of my video series called Shocking Vaccine Facts. Today I want to talk about the pressure for people working in hospitals and healthcare facilities to get the flu vaccination or get fired. Never before in history have we been forced to vaccinate or lose our job up until just the last couple of years. This all really started back in 2005 when Johns Hopkins University decided they would make it a mandated policy that anyone in the hospital had to get the flu shot or get fired. Now this movement is across the whole country, both in dental offices, healthcare facilities, and hospitals. People are being forced to vaccinate, and if they don't, they are losing their job. Statistically, though, they have found that 40% of all of the healthcare workers voluntarily got the shots, even though they were free. 30% are convinced that the vaccine is going to make them sick because they see so many people coming into the emergency room after getting the flu vaccine. So what can you do? Certainly with the economic pressures, we can't afford to lose our jobs. But can we afford to take a vaccine that has so many terrible healthcare risks? A little bit about the flu shot that you might not know. The package inserts with all flu vaccines are available online. All you have to do is simply Google influenza vaccine package insert, and you will find that under Section 8, all of them state very clearly that the vaccine has not been tested on pregnant women to see if it's safe. They also say that it has not been tested on women who are nursing to see how it will affect the milk. And of course, we don't know how it is going to affect a child who is developing in the womb when a pregnant woman is told to get the vaccine as well. And many nurses out there are pregnant. So there are 3 major concerns right there for anybody who's considering the vaccine. I encourage you to get involved in your state. In the state of Michigan, we have actually got a bill introduced, and it's called a House Bill 5605. And in this bill, we are asking that it be made absolutely illegal for anyone to be fired for not taking a vaccine. You see, if it doesn't stop here, it's going to be bus drivers, teachers in school, postal workers, anyone working in a grocery store. Before you know it, everybody's going to be required to get all the vaccines, regardless of whether you choose to or not. So please, get active. Right now there's a Facebook group called Healthcare Professionals for Vaccine Choice. It started here in Michigan along with my group and some others, and we're going to pass this bill in Michigan that will make it illegal. We encourage you to get busy in your state, get a hold of a state representative and discuss it with them and see if you cannot find somebody who can write a bill and get it introduced this fall. This is Mary Tocco from ChildhoodShots.com, helping to keep you informed and encouraging you to make fully informed vaccine decisions. Signing off. Thank you.